In April 2001, African leaders gathered in the capital of Nigeria to sign what became known as the Abuja Declaration. They pledged to allocate at least 15% of annual budgets to their health sectors. But 18 years later, in 2019, average health allowances across the continent stood at 6% of annual state budgets. Africa accounts for less than 2% of the global health expenditure, despite having 26% of the global population and 36% of the world's disease burden. Today, neglect of the public health sector, even in countries with greater fiscal capacity, is acute. South Africa, for example, is known for excellent private healthcare, but it's only affordable to the elite or those with medical insurance. Most of its people are dependent on the public health sector, which is in a state of near collapse. Africa's military spending in 2019 grew exponentially by 17%, despite no apparent external territorial threats. Ironic then that in 2020, COVID-19 became Africa's biggest national security threat since the Abuja Declaration.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Most of the continent introduced harsh lockdown protocols to buy time to bolster critically under-resourced healthcare systems.
And we have called every day for countries to take urgent and aggressive action. We have rang the alarm bell loud and clear.
Tanzania's President John Magufuli, however, scoffed at wearing masks in public. He advised prayer and taking steam baths instead, announced that his citizens would not be used as guinea pigs for testing vaccines. The publication of data and reports on the pandemic were banned. In June 2020, he declared Tanzania COVID-19 free. Magufuli died earlier this year from a reported heart disease. His successor Samia Hassan has since adopted a scientific approach. With billions of dollars donated, borrowed and secured, corruption across the continent soon came under the spotlight. South Africa has seen rogue government contracts worth almost $900 million. The health minister was forced to resign after being implicated in a graft scandal. The state-run medical supplies agency in Kenya is under fire, with government officials accused of misappropriating $400 million earmarked for medical equipment. But the resilience of Africa's people in a time of crisis shines through. Amid scarce resources, Kenya has also seen local production of ventilators and other tech innovations.
What if we build something that can help people to register themselves and keep track of them, so that shall there be a case of one person confirmed to be having corona, then the group of people he has ever met throughout can be traced as quickly as possible.
In Rwanda, drones were employed to transport protective gear, test kits and blood samples to remote areas.
2, 1.
Collaboration between the African centers of disease control and countries on the continent have seen a rapid scale-up of testing and diagnostic capacity. From only 2 centers in early February 2020 to 43 centers across Africa at present. South Africa has also reached agreement with international pharmaceutical companies to manufacture COVID-19 vaccines. The high economic cost of lockdowns forced African leaders to open their economies, but have seen a devastating second and third wave of infections. Since March 2020, available statistics on the continent puts the total number of infections at approximately 8 million. Just over 7 million people recovered, with deaths recorded at approximately 201,000. Southern Africa has seen 47% of the total infections on the continent, followed by North Africa with 29.8%, West Africa with 10.13%, East Africa with 10.12%, and Central Africa with only 2.6% reported. The continent has received 143 million doses of vaccine so far. However, logistical challenges combined with incompetent rollout strategies have seen many African countries administering less than half of the COVID vaccines they have received to date. Approximately 39 million people, around 3% of Africa's population, are fully vaccinated. This compares poorly with the more than 50% vaccinated citizens of the US and of the European Union. Only 2% of the more than 5 billion doses available globally have been directed to Africa. The disproportional impact of COVID-19 on the livelihoods and aspirations of Africa's informal economy is hard to quantify. This market, like many across the continent, is the nutritional lifeline for most Africans.
So they sell every day to be able to survive. They don't have money saved one place or locked down somewhere that they'll be spending. No.
The informal sector employs an estimated 66% of the total workforce on the continent and makes a significant contribution to its GDP. Lockdowns devastated the continent's tourism industry. The African Union reported that Africa lost nearly $55 billion in travel revenue in 2020. 2 million tourism jobs were lost in the first 3 months. Oil producers took a severe knock. In 2019, Nigeria's crude oil output averaged 2 million barrels a day. Low demand had the country reduce that number to about 1.4 million barrels. Prices plunged by as much as 50% last year. Fortunately, as lockdown restrictions were eased globally earlier this year, the demand for raw materials recovered significantly. Copper prices reached a 10-year high of more than $10,000 a ton. This upturn in commodity prices is a blessing for the continent's debt-burdened countries. Africa's over-reliance on international value chains was highlighted by the pandemic. It has again reinforced the need for closer cooperation between countries on the continent. The African Continental Free Trade Area is such an agreement and officially started trading in January this year. Through this initiative, the continent's leaders recognized the potential to connect 1.3 billion people in Africa's 55 countries. With a combined gross domestic product of $3.4 trillion, it represents a market bigger than that of India. Key to the continent re-entering the global economy will be the vaccination of at least 780 million of its 1.3 billion people. As with the Abuja Declaration in 2001, recovery lies in investing in Africa's health.